So, hello everyone. Today we have Dr. Sakhi John with us. Dr. Sakhi John is a faculty in Jamia Hamdard nowadays, and he is actively teaching students about health IT. So, since our theme is digital health, we would be podcasting him and quickly we'll try to take what information we can get out of him. So, first of all, sir, how are you today?
All well, all well. How are
All
you?
well.
So
Sir,
thank
I'm
you
doing
for
great.
inviting me.
So, it is always our pleasure to invite you for sure.
It's a great conference.
Thank you. So I'll straight away move to the questions. Since Dr. Sakhi John has worked for MIS, HIS integration, and other things in the hospital, the first question that I would like to ask him is, sir, what according to your perception is digital health?
The digital health is, of course, in terms of the digital health that we are talking, actually, especially there is a problem in a health is regarding the accessibility and affordability and also actually the availability of actually the health services. So
Right.
through this e-health platform, yes, we should be able to or we would be able to provide actually the health services to large number of the population, right? Especially when you talk about actually our public health, right? The 70% of actually your population stays with actually the urban area, right? So especially when you talk about actually this the population demographics, right? The 70% the population stays in actually the rural area where only we have actually the 30% resources
Right.
in terms of actually the manpower, material, or actually the money.
Right.
But where the 30%, 32% actually the population stays in the urban area where we have actually the 70% of
It is
actually
vice
the
versa.
resources. So there is a very big actually the disparity, or actually there is a very big actually the gap between actually the urban and actually the rural area when you, in terms of actually the healthcare delivery is concerned.
Right.
So I think yes, maybe actually it may take actually a little time with this e-health platforms with telemedicine like actually the software or actually telemedicine like actually the services. I think actually we'll be able to provide the services to the underprivileged, the rural and poor, the population in our country.
And sir, since you talked about digital health, I have seen that you have worked for HIS and MIS integration in hospitals.
Right.
So HIS is Hospital Information System, by the way. So sir, tell me one thing, like what has HIS done to disrupt the old technology first of all, and how does it is like how it is better than the conventional technology?
Right. So, see, the problem, yes, this is a problem actually, especially when you talk about HIS in the hospital information system. So, our more focus is on actually the resource management. Like example, the ERP modules, like the revenue management, right? Maybe the finance management, or actually the logistics management,
Right.
or material management, or actually your CRM, right?
Right.
So there is not less. There is very less focus is on what you called the clinical decision support or actually the clinical management system, right? So today's actually the health IT. So what I have seen is the standards are coming up. Like example, when you talk about actually the HL7 standard or actually the NABH or actually those MDDS, right? So the good standards are coming up, and that way actually the interoperability is much better now. So now the people are focusing more on actually the EMR like software or actually the clinical decision support or actually the clinical management system like actually the LIS, RIS, the EMR and everything. So that is the main difference between the conventional method. Today we are more focusing on today's software mainly focusing on actually the clinical management system as well.
Right. So since you have a diversified background, there's one question that I would like to ask you. In order to make a hospital or in order to transform a hospital, what are the necessary steps one should take?
Right, you see the digital health, yes, of course, actually, it's the good MIS or the good EMR is one of the best, the strategy you have to adopt, especially in a private or actually the corporate hospital. So that is one of the strategy. But what I'm saying is actually is the government should come out with actually the common platform to stand, right? So because especially for the repetitive test, actually the crores of rupees actually we are wasting from our part, right, for the repetitive test. And also actually the medical errors is happening because of actually this conventional method of actually the medical record system. So what I suggest is the government should not only with the standard, right, actually they should come with the common platform or common portal to not only for actually the government hospital, even for the private as well as in the corporate hospital. So then only actually we can solve this issue,
Right.
right?
Sir, I'll tell you one thing. Under the Ayushman Bharat digital mission, the government
Yeah.
is already trying to do it.
Absolutely.
Right, but it is not at that good scale right now.
Right, yeah.
It will come up to the good scale later on.
Right.
But we are looking forward to make it that good.
Yeah.
Right.
See, look at actually which mention. See, when you talk about actually the objective, right?
Right.
See, objective is actually almost it's a same, right?
Right.
Just to provide the healthcare for actually the population, right?
Right.
So maybe it's okay. Maybe it's through private setup or maybe the corporate setup, right?
Right.
But our objective or mission and vision is almost it's the same to
Right.
deliver the best patient care for actually
Right.
the population, right?
Right.
So that way, yes, the integrating this platform, right? Actually, so integrating this, the private, public, and also actually the corporate hospital in one platform.
Right.
It's a the need of an hour.
But since it is a need of an hour, sir, the need of an hour is also to adopt the technology.
Yeah.
India is poor in terms of adoption of new technologies.
Absolutely, yeah, that is
Right.
another way.
So how one should get around to make his staff, to make his clinical staff, to make his non-clinical staff adopt the right technology and to go with it further?
Right. So, like example, actually, it should start with actually your curriculum, right? Actually, so, like example, actually, when you in terms of actually, if you look at actually our MBBS curriculum or actually the BSc nursing curriculum or MSc nursing curriculum,
Right.
so nowhere we are talking about actually the health IT or
Right.
actually this kind of actually the innovative technique.
Right.
So we should start with actually is not only MBBS. I'm talking about actually the paramedical, right?
Right.
Or actually the occupational therapy or the physiotherapy, everything.
Right.
Right. Every curriculum actually we should start from actually their from their actually the curriculum, right?
Right.
So we should teach them actually from their actually the MBBS level or actually the graduation level. Then only
Right.
actually we can adopt,
Right.
because the training the staff or training the doctors on EMR, it's a very difficult, right?
Right.
So, but if you include this thing in their curriculum, right, already they will be equipped with this kind of.
So it will strengthen the whole system.
Whole system, right?
That is good to know. Dr. Sakhi, one more question. This I asked at the end of every podcast.
Yeah.
Right? If there is one advice you want to give to the people out there, because there are many young innovators sitting next to the screen and seeing you right now.
Right.
So if there is any advice that you would like to give them, please,
Right.
sir, go ahead and give them.
So for youngsters, actually, India is one of the best actually the country, right? Actually, so we have actually the good culture, we have actually very good actually the value system, right? Especially for the youngsters, actually. What I suggest is actually, don't look at actually the corporate sector, right? Actually, so work for actually the public health, right? So, to empower actually the people, right? To delivery of actually the health system for actually the underprivileged section or actually the urban slum, or actually, maybe for the underprivileged or actually the poor section in a rural area, right? Through technology. So your innovations, your education, everything actually, if you can, mold it like that, right? So you can, I think actually we can provide actually the best patient care for the entire population.
That is great to know, sir. So this was all sum up. At last, I would only like to tell you is Dr. Sakhi is associated with an NGO. So what is the name of your NGO?
The Dibalaya and the Distress Management Collectives. Yeah.
The Dipalya and the Distress Management Collections. And so where they can reach you if anyone wants to be in the cause with you,
Right.
where can they reach you?
Right. So we work for actually the street kids. I have actually the five schools for actually the street kids. We are working for actually their the education, right? Especially we are working for non-formal education. We are educating them, and we are putting them we are trying to put them into the mainstream, right? So yes, the Dibalya is one, and the distress management collectives. We work for actually to rehabilitation of actually the sex workers, right? Especially the GB Road, right? So you can associate with me. Actually, I will give you my number 9871046508. Anytime you can call 9871046508, right? So you can come and work with me. Most welcome. Thank you.
So this was Dr. Sakhi John with us, telling us all about the HIS, MIS, and digital health in hospitals. And we would like to say him more on stage. And if anyone want to associate, just write his number down and do associate with the cause, because that is the need of the hour. Thank you, Dr.
Thank
Sakhi, for
you.
being with us.
Thank you,
And
Himanshu.
it was
Thank
lovely
you very
time
much.
sitting with you.
Thank you very much.
Thank you. Take care. Stay healthy.
Thank you.